Hi, I'm Ashley Cooley, a birth, baby, and sleep specialist and mom of 3. There's so much information out there, right? This show is dedicated to helping you clear out the noise so you can figure out what will work best for your baby and your family. If you're looking to learn more about your baby, gain more confidence in your parenting, and get as much sleep as you can through it all, you've come to the right place. Bringing up baby is about to get a little easier. Hey everybody, welcome back. This is Ashley Cooley, and today on the podcast, we are diving into a topic that every new parent has wondered about at 3 a.m. or 3 p.m. for that matter. It's what's really going on when a baby can't settle or cries inconsolably or seems to struggle with feeding and digestion. So once again, I am joined by our friend Kaitlyn Sobey. She's a skilled osteopath here in Halifax, and she's going to help us unpack the story a baby's body tells us, especially when we hear words like reflux, colic, or tension. So in chatting with Kaitlyn, she really helps us understand how birth experiences can create strain in a baby's system, why things like stiff posture, arching, noisy feeding, or, a strong preference from one side or the other can be really important clues. And we also talk about how osteopathy can gently support babies who might seemingly only want to sleep like upright or on a parent's chest. So what do we do about that? We also explore when it's helpful to bring in a lactation consultant and an osteopath into a baby's feeding journey, and how quickly parents might notice changes once tension is released. So if you've ever wondered how to tell whether your baby is truly relaxed in their body or what to do if they're not, this conversation is for you. So let's dive in. What's really going on in babies when we maybe notice that they're really uncomfortable in certain positions, or if I don't know if this is even necessarily a diagnosis, maybe you can speak to that too, but reflux or colic, and those kinds of things when we're seeing babies getting really tense in their bodies. From your perspective, what's really going on there?
Reflux and colic for sure are both diagnosable conditions, which obviously we can only get a diagnosis from a medical practitioner. So that's usually your family doctor, nurse practitioner, someone maybe at the emergency room. As far as myself, I'm a manual osteopath, and then the other people who see a lot of children are lactation consultants. We can't officially diagnose. We can recognize symptoms and encourage parents to check out a primary care practitioner if that's applicable. So in regards to reflux and colics, it's a huge conversation. And we want to start first, I think let's start with the digestive system itself,
Mm-hmm.
and just kind of like high level overview.
Okay.
So the baby drinks milk, whether it's
Yeah.
breast milk or formula, that's what the baby is having. So we're talking about
Yeah.
newborns here, first 3 months of life. So the step one of digestion is the baby brings the milk into their mouth. So they're using their lips, their tongues, and their cheek to move their mouth on the nipple, whether it's a nipple on a bottle or a nipple on a breast, and that's bringing the milk into their mouth. And then they're using their throat to swallow the milk.
Mm-hmm.
So the
Okay.
milk travels down their esophagus, which is like a big tube or a straw, and then it gets to their stomach. And our stomach is on the left side of our body, just underneath our ribs. So if you like put your hand on the bottom of your left ribs, that's more or less where your stomach is. So the baby, excuse me, the milk is now in the stomach. That's step two. The stomach mixes the milk and stomach acid mix. That
Mm-hmm.
starts the digestive process, and that starts to break down the milk. From the stomach, the milk, I'm going to call it milk the whole way, but it changes from milk to poop, beginning to end. But from
Okay.
from the stomach, the milk
Yeah.
moves into the small intestines, which is again just the same tube, but it's all
Mm-hmm.
looped up in windy spots. And um so it's a long twisty tube. And then this is where the body starts to take the nutrients out of the milk. So it takes out the protein and the fat and the sugars, and it puts those nutrients into the baby's bloodstream so the baby can grow. Once
Okay.
the milk has gone through the small intestine, it moves into the large intestine, which is also called the colon. And then here is where the milk turns into poop. So the colon pulls water out of the milk, which is why baby's poop is less liquid than the milk they're drinking.
Okay.
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 So then, and then the milk travels through the large intestine and then the baby poops it out, hopefully into a diaper. Excuse me.
Or a
So that's
toilet.
like,
Sometimes people they're
or a
going in
toilet.
toilets. Whatever works.
Sometimes up the back in the car seat. That happens too.
Lots of places. Yes.
Okay, in the tub. Anyway, so that's kind of high, like that's the high level of what's happening when a baby's drinking milk and digesting.
Yes,
It's
no,
the
I
same.
love that because now we'll be able
But
to
this
like really simplify this of like what's actually going on so
what's
we can
going on.
see. Yeah, yeah, yeah.
Yeah. So reflux, or also called GERD, that's when the connection between the esophagus, which is the tube in the chest, to the stomach. So it's like a straw into a pouch. There's a little valve that separates those two. And
Mhm.
when the baby swallows the milk, that valve opens and allows the food to travel from the esophagus into the stomach. And then when the milk is in the stomach, the valve closes. So when
Mhm.
a baby has reflux, the valve doesn't close.
At
So what
all
that
or to varying degrees?
it to
Like,
varying, let's say to varying degrees. So
okay, sure. Yeah.
there's like a miscommunication between the brain and the valve. The valve doesn't know it's supposed to close. So what happens is number one, babies spit up a lot because
Which
there's
is
no
pretty
lid.
common, right? Again, like to varying
Yeah,
degrees, we're going to maybe see the occasional or small amount spit up, or we're going to
for
see
yeah, and
extreme
the
vomiting
occasional
almost.
small amount spit up is one thing, but it's another thing when like parents will describe it as projectile. So it's like there's a lot of milk coming up and it's fresh
Yeah,
versus like partially digested, which kind of looks like the curdled.
right,
So,
right,
but
right.
what is this? This hurts. So it's like there's also stomach acid coming up. So it's the same. Reflux is the same as GERD in adults. The same thing's happening is that there's the the valve isn't closing. Excuse me. So some signs of reflux is that there's a lot of spit up after feeding. Like the baby eats and then you sit them up to burp them, and they burp or they don't burp, but there's a lot of milk comes back up.
Does it
They
have to
get
be, is it's too soon to ask questions, but does it have to
no,
be like right away after or like within a couple
no.
minutes or could it be a half hour later? Like,
Yeah, it
does
could
that
be
vary
later
too?
as it could be
Okay.
later as well. And I find the spit up is like harder to landmark off of. Is it reflux? It's really more about their comfort level because you have babies who spit up a lot, but they're, I'm using air quotes, happy spitters. They don't seem to be bothered by it, but reflux seems to hurt babies. So they're starting to arch their back, they're screaming, they're having a lot of coughing or hiccups, or they're like gagging. So it's almost like
Okay.
they have something sour come into their mouth and they're
E-
gagging. They have a lot of
Even
hiccups.
when they're not eating, like
Yeah.
it's just, what about silent reflux though? Is that just a term that
Silent
people say? But
silent
what's,
reflux is often reflux. My understanding of silent reflux is that it's reflux without the spit up. So
oh,
some
so
doctors
there is
landmark on the spit
pain.
up, but
Okay,
there's
but
still
there's,
pain. But
okay.
they're keeping the milk down, but there's still pain.
Okay, that makes sense. So, gosh, it just makes it like there's so many different ways to experience this. So
Yeah.
how struggling, yeah, how much that might be a struggle to figure out.
And it can
Anyway,
be so
go ahead.
confusing and overwhelming for parents too, because especially if it's your first baby, I hear
Hmm.
so much from moms in my office that like this is my first baby, so I don't know if this is or is not normal.
Oh gosh, that must be the most
Right?
common
So
thing
it's
we all hear. Yeah.
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 And so and then versus colic. Colic is so reflux is more of a um, there's a bunch of different options for reflux. Probably one of the most common options is for the babies to go on a medication, like a proton pump inhibitor, so it stops the reflux. But then
Hmm.
colic is much more complex, I would say. So there's a rule of three for colic. So if the baby's crying for 3 hours a day, for 3 days a week, for 3 weeks or more,
Mm.
and then the baby's otherwise healthy, they're gaining weight, they're eating, they don't have any medical concerns. It shows up around 2 or 3 weeks old. It peaks around 6 weeks old, and then it usually resolves itself around 3 months. So it's like that fourth trimester.
Hmm. Hmm.
And colic is there's no known reason. So more often than not, if a parent comes in and they say they have a colicky baby, I think, okay, well, the baby medically has been cleared for me to treat. So it's totally safe to treat this baby. There's no real medical concern. It's really a quality of life for the parents and for the baby.
Yeah. Yeah. I think that's why I was thinking that wouldn't necessarily be considered a diagnosis in my mind, is that it's because there's diagnosis to me is like you're saying, okay, there's something going on, there's something wrong, or there's something that needs
Yeah,
or could use some help, like with the reflux.
yeah.
But here we're saying like there's nothing medically going on, so we're free to treat. You are, and just like quality of life, like you said. So because
Yeah.
what you described as that and how it peaks at 6 to 8 weeks and sort of tapers
Hmm.
off 3 to 4 months, that is what's called the crying curve, which all babies all over the world, across genders and cultures, are doing that same thing. But there are some babies that they call them the high criers. So they're not the bad
Hmm.
babies. They're not the,
Yeah.
harder to, but it's the high criers. There's the medium criers and then there's the low criers, but they will all follow that curve. So
So
naturally, we're probably talking
interesting.
about the high criers that
Yeah.
are really, and it does peak because it does start around 2 weeks, give or take, of course.
Yeah.
Um,
Yeah, that's so
yeah.
interesting. And then good too, because a lot of people like, what we'll go through. I have some notes here to talk about, some signs and all that stuff and signs baby might be uncomfortable digestively or in their body or whatever. And
Hmm.
it's like so important to remember that all babies cry.
Yes.
Like it sounds,
Yes.
in a way, it sounds silly to say, but like some babies have cranky days and they have cranky times of days. And so all babies cry. So just because your baby's crying isn't a sign that they have a ton of tension or that they're having digestive problems or anything else. It's like sort of, I look at it as the quality of the cry, right? Like
Mm.
can they be pacified? Are they,
Hmm.
if we've checked off their fed, their diapers clean, they are not tired, I'm cuddling them. Like, can they be, calmed?
Hmm.
It's when we can't calm the baby, like the baby's really upset, really red face, this like high pitched, really shrill scream. That's a
For
different
multiple
kind of cry
hours.
for
Yeah. Right.
multiple hours. Yeah,
Right.
not just
Yeah.
like it's 4 o'clock and the baby's been fussing for a while or cluster feeding at 6 o'clock at night. Like it's not
Yeah.
they're not the same thing.
Yeah. Got it. Okay. Um, yeah. Okay. Well, geez, already learned so much. Well, I think I maybe know some of the answers to this, but I just love hearing it from you and with your experience. But how can birth experiences create tension that can affect baby's digestion? So we've been talking about like reflux and colic, but just like general, and maybe this is part of that too. But how can birth experience kind of create tension for babies? Or am I asking that right?
Yeah, no, that.
I just don't want it to seem like, oh, well, it's my fault because this is how I birthed my baby, but it's just
Oh my
sometimes
gosh,
during
no.
childbirth for
Absolutely.
various reasons, positioning or
Hmm.
size, what have you, but like things can
Hmm.
happen. So yeah, tell us about that. What are your
Yeah,
experiences
and
there?
baby's really squished in there by the end as well. So it's like one
Yeah.
part, what was the birth like? What was the birthing experience for baby and for mom? So both are participating, right? The baby is born and the mother is born. I don't mean to be too woo-woo or cheesy about it, but it's very true
That's true.
that
Yeah,
when
yeah.
when we give birth biologically for the first time, then you become a mother, and then that's a transformative experience.
Mm-hmm.
So one of the really interesting things about colic is in that the medical profession is saying we don't know what causes colic. There is some research showing that um, the baby's immature nervous system, they
Mm-hmm.
can feel overloaded, like they're getting sensory overload. So
Mm,
there's too much stimulus and they don't know how to process the stimulation. And then
mm,
then so they're getting upset. Another theory is that there's a lot of neck and head tension, and colic can actually be the baby's response to a headache, which is really interesting to me, the manual
yes.
therapist.
Yeah. Yeah.
That's what,
No,
but that's
absolutely.
like, when I read that, I was like, oh my gosh, that's really an interesting consideration to me, is that the baby is in pain if there was compression or a lot of tension through the head and neck during birth, or even, depending how they were lying in the womb, how they were
Sure.
in the uterus. Um, and then lastly, in regards to colic or gut health, is that antibiotics cross the placenta. So if mom required antibiotics during pregnancy, if she
Hmm.
had antibiotics during labor, so that would happen if she was group B strep
Strep pop.
positive.
Yeah.
Yeah, if there was a cesarean, of course. And then anytime mom has had an IV, so if there was an induction or just fluids, I think, there is the possibility. We don't know for sure that baby hasn't had antibiotics. And then, of course, if mom's breastfeeding and she has to take antibiotics for an infection. So it can also be the baby's gut biome has been affected by exposure to antibiotics. And then
Okay.
baby probiotics can be really helpful.
Okay. Okay. So yeah, that's something I hear a lot circulating on, groups on online and stuff is either my baby's colicky or gassy, and what are people doing? And you hear a lot
Hmm.
about like these drops and things like that that might be helpful. But of course, it's going to work for some. It's not necessarily going to work for others because there would be
Absolutely.
different reasons for them experiencing what they're experiencing. So
Yep.
that's so
And
tough to navigate though, isn't it? So you must see such
yes.
like an array of like got like that what you just said, like I don't know what's normal and this didn't work, that didn't work. Yeah,
Hmm. Hmm.
that's a lot.
And then, so in regards to just going back to your other question, your previous question about what did you ask me what birthing experience can cause
Yeah,
tension?
yeah, yeah.
So, there's sometimes I treat babies and mom tells me that the birth was really complicated, or they labored and then they fully dilated, they pushed for 2 hours and then ended up having an emergency C-section. Like that's a really, really tough birth
That's
for
a
mom
lot.
and baby.
Yes.
There's
Yes.
times when, a bunch of different situations and baby is showing a lot of tension in their body. And then there's other times that mom comes in and says, everything went great. I went into labor on my own. It was textbook. There was no interventions required, et cetera, et cetera. And baby is really tense. So it's easy to kind of make a checklist and say, if X, then Y, and baby will show up with tension in your office. But the
Mm,
reality of it is, I find clinically, is it's not that simple. So I don't know if it's just how babies are in the womb, if it's how they're presenting at time of birth when they travel into the birth canal. I just know that it's not always as simple as saying it was a tough birth, so the baby has a lot of tension, or the opposite
sure.
of that is not enough tension, like they're really like a super, super floppy baby.
Okay. Okay. Yeah.
So I don't have
Yeah.
a good answer for that one,
No, but you know
or
what?
an easy answer.
This is this the right way to say this? Does it even matter? Like, I mean, yeah, I tend to look at like, oh, gee, yeah, how did that happen, or could that have been prevented? And again, like,
Yeah.
this is not meant to for anyone to like, oh gosh, I want to avoid that because this could happen. Like, gosh,
Hmm.
we don't know. So,
Hmm.
in terms of treatment, you're treating the symptoms, I'm guessing. I mean, of course, yes, good to know you're asking the questions, you're getting a full picture of the health and all of that stuff. But yeah, does it really matter why? If there's tension, there's tension. Let's work on that. Let's see what we can do to
Yeah,
fix that.
that, I do obviously ask like how was birth and were there any interventions, and check in with mom too, how's she doing? It's usually mom in the office, sometimes dad comes, but more often than not it's mom, and check in with her and how is baby um getting used to life earthside, right?
Yeah.
Like they
Yeah.
go from being
Transition.
in warm water to being in cold air. So in water, like in the amniotic fluid, that's when the baby begins to develop their sense, because they can feel the fluid because it's warm. So that's when they start to understand, like, here is my body in space. So it's
Mm-hmm.
like, it's called proprioception. So if you think about your toes, you don't have to look at your toes, you know where your toes are.
Mm-hmm. Mm-hmm.
Right. So that's our developed sense of proprioception. And then suddenly baby's out of the water is freezing. They have no sense of where they are in space. And now there's gravity to contend with. And their body
Mm-hmm.
is so heavy and hard to move. So it's like, it's a huge adjustment for the poor baby if you think of it like that, right? Like
Really
it's
huge.
it's a huge adjustment. It's like, oh my gosh, they have to get used to gravity. So one of the best ways, go figure, Mother Nature figured it out, for babies to develop proprioception, specifically newborns, is to be held. So a lot
Mm.
of people are like, well, in a 3 week, 4 week, 5 week old baby, the baby doesn't like to be put down. Of course they don't. They were just held for their entire life. They need to be
Mm-hmm.
held for reassurance, to know they're
Mm-hmm.
safe, to feel the warmth, and that's a really, really important part of parent bonding. Obviously there's times
Mm.
we want them to sleep independently in their bassinet, but through the day, a lot of babies really want to be held a lot, and that's
Yes.
totally normal.
Yes, thank you for saying that. I shout that from the rooftops as much as possible because, again, you just brought it up. Like we want to talk about safe sleep and how we sometimes need to put babies down so that we can sleep and we can all
Of
be
course.
safe, whether they're in their own space or co-sleeping or whatever you're doing safely.
Hmm.
But during the day, do not expect to be able to put them down and find ways like baby wearing or,
Yeah.
having support and other ways that like we can still hold and have babies close because that's ultimately, our best case scenario or our best chances of helping baby adjust through this
Yeah.
transition. It's
And
so
and
huge.
that
Yeah.
yeah, and I think if we don't know that going into it, or if maybe that was we had a different experience in what we have perceived in people raising children or what we experienced as raising a child, it's like as being a child being raised, right? We can have this expectation that you just can put the baby down. Like, why is it a fussy baby? Why does the baby need to be held? So I think the helplessness of newborns can be a little overwhelming to new parents as well because they are completely dependent on you. And that's a shock, I think, to every new parent.
Absolutely. Absolutely. And just when you think you've got it figured out, they flip change on you. And now it's like, oh, what changed? And now we got
Yeah,
to learn it all over again. Yeah,
it's
yeah,
true.
absolutely. But talking about that, this being the norm. And so when we do see or meet or have a baby that maybe we can put down a little more often or with more ease. I call those the magical unicorn babies because there's always a few. There's
There's
always a
always
few,
a few.
but that's
Yeah.
not the norm. Is
No,
is
it's
really
not.
what it comes down to. Anyway, okay, let's get back to this.
Okay.
How can parents notice at home when baby we talked a little bit about some of those reflux symptoms, but
Hmm.
maybe we can revisit that. So whether it's reflux, colic, any kind of tension, obviously we're going to think, oh yeah, baby's going to cry. Yes, babies cry for lots of reasons, but we talked about the colic and how it's for multiple hours, and kind of crosses over days and weeks and such. But what about just if you're noticing tension, what are some things that parents are maybe looking for or might notice that their baby has tension in parts of their body?
So a big one is if they're arching their back, especially
Mm,
when you're trying to feed them or burp them. Like if they're up on your shoulder or you're kind of have them propped seated on your knee trying to burp and they're arching their back, or you're trying to give them a bottle or breastfeed them and they're like flopping backwards, that's a really big sign of tension. They can
okay.
be frantic at the nipple. So again, like whether it's a breast or a bottle, it's almost as if they don't know what to do with it. Like if you put the nipple in the baby's mouth, we want the baby's reflex, excuse me, to latch onto that nipple. But
Hmm.
when the baby is, it's like they kind of like shake their head back and forth. It's like they're confused. Like, I don't know. I know I want this and I can't figure out how to get my mouth to do what I want it to do. So that's a sign of tension.
So, but is that tension like in their jaw, maybe, or where
It
would
could
that
be
be
tension that
specifically?
that could be in their jaw, but then we think, okay, well, their jaw helps them eat. But the whole process of swallowing involves the jaw, the base of their skull, their shoulders, and the muscles in the front of the neck. So it's actually a
Okay.
big part of the body involved in suck swallow.
Sure. Well, makes sense. I'm very curious because I can totally picture what you're describing when
Yeah.
my littles were little of not maybe not doing that obviously wasn't regular enough that I felt like I needed to seek help for it. But
Hmm.
I definitely remember times where they would do that and I was always like, what are you doing?
What are you
Like,
doing?
well, it's right here. Like, what's going on?
Yeah.
Anyway, then that's
Um,
interesting.
yeah, and so if they're off and on a latch, like if they're not able to hold a latch, they break it or they come off and turn their head away. If they're
Mm,
really messy eaters, so if there's a lot of milk leakage out of the corners of their mouth, like
hmm.
if you're feeding the baby and you need to put a blanket on the bottom side of the baby to catch all the milk they're leaking out, that's not a good latch. So something is preventing that. A really hard belly.
Mm. Like before, after eating, or anytime?
Almost like it feels in your on your if you put your hand on their belly anytime, if you
Yeah.
put your hand on their belly, it almost feels like they're bloated, like it's
Okay.
hard to touch. So that's like there's a lot of gas in there, a lot of spit up. Like some spit up is normal, but if it's happening, there's a lot of spit up and it's happening frequently, then there's some trouble through the digestive tract. Not pooping every day, despite uh, the medical world, I believe, says as long as a baby poops every other day or a few times a week. I'm
Right,
of the
right.
mind that, I want all humans to be pooping every day, right? Like we
Yeah.
want the baby to
Okay.
poop every day, and
Yeah.
adults too. And then if there's mucus in the poop or green poop,
Okay. Then they're not
and
digesting properly or something's going on
yeah,
with that
a lot
digestion.
of gas
Yeah.
in the digestive tract. And then the last one that I have written down here is if a newborn has a really strong neck. Hear people saying, "Oh no, they're holding their head up. It's a really strong neck." What that
Oh,
is the back of their neck is so tight. It's like their neck is an extension, so they're stuck looking up. It's not that their neck is so strong. They're newborn. Their neck is not strong.
interesting. Are they doing that all the time too, or
A lot of
a
babies are
lot of
doing
time?
that. Yeah,
Okay.
if they're anything but laying on their back, and if a lot baby has a lot of tension too, often it's very uncomfortable for them to lay on their back. So some babies prefer to sleep on their propped on their side, or some
Yeah.
babies, newborns even kind of roll to their side and end up sleeping
Yes.
there.
They call it the newborn
But
curl.
yeah,
Yes, yeah. So you see that too, eh? That's oh, it's so interesting. That and that's I probably said this to you before and in our last podcast together, but it's just definitely something that I screen for, and because we do, and I've had a baby like this too. I just didn't know there was support for it at the time,
I know. Me too.
but could not put her on her back. Like I do prepare parents sometimes in prenatal, being like, your worst case scenario with sleep in the newborn phase is that you might have to take turns staying awake, holding the baby, so that one of
Yeah.
you can get some rest. But like one of the things you could potentially do, if it's covered by your insurance and things like that, is like go see an osteopath, and see because like we'll probably get into this, but like how it looks and how it is to be treated, it's not in any way, shape, or harmful for a baby.
Oh my
Um,
gosh, no.
if anything, you get maybe some great advice, but like it could actually be potentially helpful for just if there is tension, that could
Yeah,
be a helpful
absolutely.
tool. Yeah.
Absolutely. Thanks for the
Um,
shout out in your classes.
you bet. Anytime. Um, when you had mentioned earlier about happy spitters, and just when you were
Hmm.
describing that, are we worried about our happy spitters, even if it's a lot?
That's a good question. Like my question is, what else is going on with the baby and what else is going on in the family life?
Okay.
Like if you have a happy spitter and it's baby number three, and there's two other really young kids in the house and a couple dogs and a cat and the partner who works back shift and the baby's happy, it's like, don't worry about it.
Caitlin, I love you.
You're
You
fine.
just described my life so well. Not that we neglect our children, but if it's like,
But
well,
it's like,
I
let's
think
have
you'll be all
realistic
right.
expectations of ourselves as
Yeah, this
parents,
will build resiliency, won't
as
it?
human
Yeah.
beings. Yeah. So
Okay,
the
okay.
thing is,
This is
yeah,
good. I love it. I love it.
Yeah.
So yes, it doesn't hurt to get it checked out, but like,
It
hey,
doesn't
if
hurt to get it checked out.
everybody's ultimately
For
happy and
sure. Like
pooping every day, then we're good.
exactly. I had a coworker who has a new baby in their family, and they said, "Would you like to treat the baby? Should you treat the baby?" And I said, "Well, tell me about the baby." And my coworker said, "Well, the baby sleeps great and is happy all the time and nurses great and is gaining weight." And I said, I'm not touching that baby. He doesn't need to come see me. I could find stuff to treat, of course, but we don't need to,
Yeah, yeah.
right? Like look at the barometer. I look at the barometers is how's baby sleeping? How's baby gaining weight? How's baby pooping? How's baby eating?
Nice.
How's baby's demeanor?
Yeah.
Right?
Yeah.
Like if
How's
those
quality of
things,
life? What can we
how's
do
quality
to
of life?
help?
If those things are okay,
Mm-hmm.
sure. Come on in for a check. I can always find something to treat. We can have a conversation. I'm happy to treat everybody.
Mm.
But if then you think, well, taking the baby to a practitioner, an appointment, it's just too much. It's more than I can handle right now, then it's okay.
Yeah. Okay. Now, flipping the coin, if we are noticing some of these symptoms and signs of tension or gas or, baby's uncomfortable in some way, they come see you.
Hmm.
I'm obviously, I'm practically thinking, okay, it obviously depends on what the scenario is and how you're treating it and what have you. But like, how quickly could we notice changes? Like, are we talking like we're seeing you for a year? Are we like off and on? Like, what does this look like?
So my hope is that there's improvements right away. So I usually treat babies once a week for a few weeks, 3 or 4 weeks, and then start to space it out. Unless unless it's an extreme situation. But for otherwise generally healthy babies who are gaining weight well,
Mm-hmm.
I usually do once a week for 3 or 4 weeks and then assess from there. And
Okay.
my hope is that they see when they come back for the second appointment, the parents are said there's been some improvement in some way. And then,
Okay.
within 3 or 4 months, a lot of babies who I treat as newborns, by the time they're 4 to 5 months, I'm really not seeing them very frequently at all. I generally say, big physical milestones is a good landmark. So by the time they're getting up into hands and knees and rocking and and that sort of thing. But no, there's lots of babies I've treated, they're two and I've treated them since they were newborn, which I love. But the
Mm-hmm.
frequency is not nearly the same. Really, it's those first few months that they
Mm-hmm.
respond so quick, that they respond so quickly, especially to feeding and tension issues. It's like such a quality of life. And then once they're on the
Mm.
go, they really don't need a lot.
And it all it gets it gets
For a
easier
generally
to
healthy
read.
kid.
Yeah, they get
Exactly.
easier to read or like we
Yeah.
can we notice more specifically, yeah, maybe what's going on. Okay, that's so reassuring. I think that's reassuring. It's just like, oh gosh, like is this permanent or like how long do we have to and with the crying curve and colic and stuff, sometimes there are processes out there that we can't take all the crying away, right? We can't take necessarily all of those things away, but if we can help improve quality of life in some way, shape, or form for baby and or parents, like
Yeah.
that's what we can do.
Yeah.
So we talked about tension. I think you mentioned this earlier too, like babies can be too relaxed, maybe,
Yeah.
right? So
Yeah.
so how can we tell where is our sweet spot? We
The
want to
sweet
see
spot.
sometimes you're going to see some tension like with reflexes or with like hunger cues and stuff, but for the
Yeah.
most part, we're not looking for totally floppy, but we're looking for yeah, how would you describe that? What are we looking
So we
for?
want the baby. So we're talking about a regulated baby. So again, back to this is like terminology in regards to the nervous system. So a regulated baby is able to handle and process the sensations that they experience without getting too upset.
Mm,
So they feel, a rumble of hunger in their belly, or they feel like they need to poop, or they feel like I need to be comforted. Where's my mom or my dad? Right. And
mm,
then, of course, then they send us cues, and sometimes we catch them and we pick up the baby, and sometimes we don't catch them until the baby's crying. So a dysregulated baby is often, it's like they're overstimulated. So going back to what we said about the colic, it's a whole conversation. It's really, really interesting about what's going
mm-hmm.
on with baby's nervous system and why some babies react differently than others. There's a really awesome book. I discovered it as I was a parent. Now, my oldest daughter is now 19, so this was quite some time ago that I discovered, but it really helped me with her, who in science of hindsight, I believe was a colicky baby. Um, and it's called The Highly Sensitive Child. I don't know if you've
Mm.
heard of it before. It was
Yes, I
really insightful
have.
for me, like as a mom, not in my professional life, but in my
Mm-hmm.
mom life. It's
Mm-hmm.
been really helpful for me. And so I have wondered if there is a correlation. I have wondered this, like from what I see clinically, if there is a
Yeah.
correlation between highly sensitive people and colicky babies.
Mm.
So it's
Sure.
really It's really
Very
interesting. Anyway,
interesting.
so for
Yeah.
anyone
Yeah.
who's dealing with, in that age of, I'm going to say like 1 to 1.5. It's like, oh, my kids really gets overwhelmed by big feelings, by loud noises, by fluorescent lights, like the grocery store, the mall, places like that. It's a really interesting book. I would highly recommend it to a lot of people.
Oof.
But
I
in
would
any
also
case,
ask, like, I gosh, I know a handful of adults, sometimes depending on the day for me, if you put me in a busy grocery store
yeah,
with too many lights and stuff, I'll get me
yeah.
out.
Turns out
Um,
there's also one called the highly sensitive adult.
yeah.
So it's just highly sensitive
Is that
people.
not all of us?
Yeah.
At least I like to think so. It's not
Or in
just me.
caring professions, probably.
Oh,
Um,
yes. That's
in
another
any case,
conversation.
yeah,
Yeah.
it is. So dysregulation, it's like the baby's overstimulated. We want them to be relaxed in their body. So signs that they're relaxed is that their breathing is regular, their body looks floppy. Like if you think of a baby sleeping, their arms are out, their legs are flopped, like they're total blissfully looking. Um,
Mm-hmm.
an older baby, once they get a little older, so I'm going to say 6-ish weeks, but I'm not 100% sure, they're going to start to make eye contact and you can see them engaging with you in their eye contact, 6 weeks, 8 weeks sort of thing.
Mm-hmm.
And then they're comfortable when they're feeding, which is huge, and they wake up gradually versus waking up crying.
Mm-hmm.
So now then it's like 2 a.m. and the baby's crying. We don't know if the baby woke up crying or if the baby woke up, gave its hunger cues, and now is crying, right? But when we
Right.
see baby like during the day, they wake up gradually, maybe squawk a little bit, but they're not waking up screaming.
Right. And can we specify this in that infancy stage? Just because as a sleep consultant, it's super common for older babies, say, to wake
Yeah.
up and cry and then,
Yeah.
right? So can we say that though? Would that be accurate to say like in that infancy stage specifically that if it seems to be like a wake up scream that we
A wake up
notice?
scream. Yeah. I would say
Yeah.
like sometimes babies wake up and they make noise, like their squawk or they give a little cry,
They're
right? But
usually
it's
doing
not
some hunger cues though before it gets like
exactly.
full blown crying.
Exactly,
Yeah,
but
yeah, yeah.
it's not that like red face, high pitched shriek scream.
Which I think a lot of parents just innately intuitively we know when
Yeah.
something's wrong, right? And so but
Yep.
so it's never wrong, I think, to get things checked out, ask the questions, because how are you supposed to know this if you haven't done it before? Um,
Absolutely.
but if your baby's responding in ways that really make you question, gosh, this seems, I don't know, is this normal?
Yep.
Best to go get checked. Absolutely. I think
Yep.
we would
Absolutely.
innately know those things. So, but it's still helpful to kind of review kind of what we're
Yeah.
looking for. I'm a
Yeah.
checklist person, so why not?
And then on the other side, so we have a baby who has what would be called a lack of tone. So it's like they're too
Right.
floppy. So
Yes.
we're seeing or slower reflexes. So of course you
Mm,
want to see, on a newborn baby, if you rub their cheek, they're going to turn their head in the direction. That's their rooting reflex. We want to see that for sure. But babies with low tone are, it's like almost like they're not really moving.
mm,
Even
hmm.
regulated newborns, their
They're kind
movements
of,
are their movements are jerky because
yeah,
they're just new to
yeah,
everything.
yeah.
Um, like
Point
gravity,
said.
muscle,
Yeah,
like it's they're
yeah.
brand new, right? So their movements are jerky. A baby with a lack of tone is almost like they're not moving very much at all. Like they would be
Mm,
such a quote unquote, such a good baby,
yeah. Right.
right? So it's like,
Right.
no, they don't do
They're
anything.
not doing much at all.
They're
Okay.
not doing much at all.
Okay.
So not
Okay.
to, yeah. But anyway, like I say, I mean, I totally agree with you. But then there's something really wrong. You instinctively, with your
Yeah.
baby, like that's a cry that is hurting me too. Like I'm reacting biologically to my baby's pain.
Mm,
And then before we get there, if parents are like, I'm not sure, like this is a really easy baby, or the baby's fine, but sometimes they do this or whatever. Like the baby's fine, but every time they poop, it's a huge blowout, but they seem happy. Like for sure, book in with a manual osteopath or any other practitioner, manual practitioner who treats babies. It's very beneficial.
mm. And like we said, like doesn't hurt.
Oh my
Even
gosh, no,
just for an assessment. Yeah.
no.
Wow, this has been very informative. I love this conversation because, again, with that crying curve, and we do, we want to be able to help support parents wherever they're at. And that um, comparison game can be played even amongst your own children. I've noticed.
Yeah,
Not that I like to
absolutely.
compare my kids, but
No,
like
but absolutely.
if the two of them were born in the same month, 2 years apart, so it's very easy to look back and be
Yeah,
like, oh, your sister was doing XYZ at this time and
yeah,
you're not, and what's going on? So they're all
yeah.
different. We got to take it as it comes and see, but knowing where supports are is so helpful. Is there anything we didn't chat about here, Caitlin, that you wanted to touch
Um,
on related to
let's
this? I
just
feel like we
yeah,
covered lots.
let's just chat briefly about when to involve a lactation consultant.
Yeah, you know what you were mentioning a lot about like the feeding stuff with
Yeah,
obviously not just positioning, but like those things around feeding, and it makes so much sense that how you'd want to have lactation consultant as well as someone like yourself to
yeah.
work together because it is a together kind of issue, isn't it? So yeah, tell us about that.
So one of the I think biggest misconceptions about lactation consultants is that they only work with babies who are being breastfed.
Yes,
So
yes.
lactation consultants help all babies, whether they're breastfed or bottle fed or combo fed or syringe fed. Like lactation consultants are a really incredible resource. In Nova Scotia, anyways, we have a good amount of lactation consultants who are private in the private healthcare. And then we
Mm-hmm.
also have some lactation consultants available through the public health. So
Mm-hmm.
cost isn't necessarily a barrier, which is wonderful. So as a new parent, if you're having any feeding troubles at all, or if you're unsure if baby's gaining enough weight or eating enough or pooping enough or crying too much, the lactation consultant can be a fantastic place to start. Myself, I work with them a lot. Like we do a lot of counter referrals. I receive babies who have been referred to me by a lactation consultant. And if I'm seeing a baby and I'm like, do you know what? There's something going on that's beyond my knowledge, I'm going to send them to a lactation consultant as well.
Mm-hmm.
Um, so that would be a great place to start for lactation consultants. If there's, the feeding issues we talked about before, if it's they're having trouble staying on the nipple. So they come off and on and off and on. If there's like the clicking sound, so it's like sort of like a smack, the baby's losing suction. If they're really
Mm-hmm.
messy, so there's a lot of milk dribbling out the side of their mouth.
Mm-hmm.
If you aren't sure if they're gaining enough, if you aren't sure if they're eating enough, if you aren't sure if you have enough milk, if you're breastfeeding, and if you don't want to do like what's called dessert bottles. So if you really want to exclusively breastfeed, but you're not sure how much baby is eating because it's impossible to know because you can't measure.
Well,
Lactation
this
consultants
is
are amazing. They're
absolutely.
such an
And
incredible resource.
I'll also rewind and say, prevention wise, come to prenatal class because that
Yes.
preparing parents for, especially if they're going to breastfeed, but we also talk about like best practices for like bottle feeding and stuff and
Yeah.
positions and things like that. Like you said, it's not just with breastfeeding, but there are certain things that if we don't know ahead of time when we're
Yeah.
thrown into that moment, it can feel really stressful because feeding is a huge, obviously, need for
Um,
your little one, and it
yeah.
can be a big stress for parents. So
Yeah.
knowing
It
again where to get support so quickly is is
It really
necessary.
can be. And if there's not support, especially when the mom is breastfeeding, if there's not support and there hasn't been, you know, the mom hasn't pursued a lot of breastfeeding information on her own independently because that's the only way you're going to get that information,
Yeah.
then there can be a lack of knowledge of like, what does it feel like when I have enough milk? What are the signs that the baby is swallowing milk and drinking enough? Like about the wet diapers, about the poopy diapers, like it is important. I'm not at all a fear monger. And it's important that we are sure the babies are getting enough to eat
Mm-hmm.
while we're establishing breastfeeding.
Mm-hmm.
If that's, specifically in this, because with formula, it's easier to know that they're getting enough. So,
Yes, but
and
getting that
it's
support early on, as
abs,
early as possible, is very
yeah,
crucial
absolutely.
for
Yeah.
all of it, for the relationship, for your well-being, babies, everything.
Yeah,
Yeah.
absolutely.
Not to put too fine a point on it. But again, I get so pumped up about it because I'm like,
Yeah.
I'm so glad you're out here and I've been able to, it's great to get to chat with so many people on this podcast that are, I mean, yes, many are local to Halifax, but just there's osteopaths in lots of cities. You can find them.
It's true.
But just
They're all over
knowing,
Canada, I think.
yeah, but we do have to make our own village, right? So it's like,
Hmm.
okay, what can you help with? When might I need to contact someone like yourself and all that stuff?
Yeah.
So those are some great points around not just those signs of milk intake for baby, but whether that's breastfed, bottle fed, you know, so, tube fed, whatever you're doing. Those are good points to make, things to look for. Beautiful.
Awesome.
I feel like that was so great. Thank you so much
I
for
know.
coming
It was really
back,
fun. Oh
chatting
my
about
gosh,
this.
it's so enjoyable being here.
Thanks again so much, Caitlin. It was great to chat
Okay,
with
so,
you
so good
again.
to see you, Ashley, and I'll see you at the Birth Expo, if not before.
Yay.
I
Okay.
can't
Let's
wait.
awesome. Awesome.
If you're looking for more information or support along your parenting journey, check out birthbabysleep.ca. That's where you're going to find prenatal classes, postpartum and new baby resources, and sleep support during the childhood years. Lastly, but certainly not least, if you got something out of this episode or our show in general, leaving a rating or a quick review goes a really long way to helping others find us. So please consider leaving one. That's all for now. I'm Ashley Cooley, and we'll see you back here next time.